Ladies and gentlemen, welcome to In the News. My guest today is Mr. Pankaj Sahni, the CEO of Medanta Hospital. Medanta Hospital has recently been accredited as one of the best private hospitals in India. We speak to him about Medanta's expansion plans, what makes Medanta the hospital that it is. He even speaks to us about the National Digital Health Mission. Welcome, Mr. Sahni. Thank you for talking to us, and congratulations on being accredited as one of the best private hospitals in India. Tell me, what is it that makes you so good, and what is it that makes you what you are?
So I think that there are 3-4 things that we feel is the reason why organizations such as Newsweek have ranked us as the best private hospital 3 years running. And that has to start first and foremost with the kind of clinical excellence that we deliver. So when you look at the way in which Medanta is structured, when you look at our doctors and our nurses, and when you look at our entire ethos, whether it is the quality of the clinicians, whether it is the technology that we bring to bear, or whether it is the infrastructure and the way we're laid out, and the basic value system that we have put into place from the time when we started the institution, to actually say that the key in our success will be making sure that we can deliver healthcare at the absolute highest standard. So the way in which we always have looked at it is to say, deliver the best possible medicine that you can, and everything else will kind of follow from there. So that is, I think, the real crux of what we've tried to do. And that ecosystem and that thought and that values flows down into, every kind of aspect of how we think about whether we should put a certain physical infrastructure in a certain place, whether we should think about what kind of a machine we buy, or whether we think about the kind of recruitment that we do. So when you walk into, our Medanta, you will see this big, huge symbol of our tree of life, what we call our foundation stone or our real soul of Medanta. And underneath that, there is this bowl where people have this molly thread which they can tie and they can make a prayer or make a wish. And one of the inscriptions on that actually says, Har ek jaan anmol, or every life is precious. And that is the fundamental ethos with which we've tried to do everything that we do in our organization. And maybe that's the reason why people appreciate us and rankings such as Newsweek rank us.
Wonderful. That's wonderful. I want to know a little bit about your expansion plans. What is it what's new? What can we expect in the near future?
So a couple of things are already in process, several sticks in the fire, so to speak. So we currently have 5 operating hospitals. That's in Gurgaon, Lucknow, Patna, Ranchi and Indore, with our inpatient services in Patna actually being our most recent addition. So we started out those services right before, at the start of this year, just before the Omicron wave came around actually. And we will be building a hospital in Noida as well. And that is something that we have already started our activities on, the construction and the planning activities, etc., happening for that. So we'll be 6 hospitals that are currently in the system or are ready to kind of get activated. The other thing that we're doing is looking at how you think about services which are associated with this. So whether it is home care, whether it is outpatient pharmacy services, we started that as well last year, or whether it is using technology, things like telemedicine, etc., to be able to deliver care to patients beyond the boundaries of the clinic or of the hospital system. So these are all the plans that we have, which are live, which are everybody is aware of, which are public, and which are underway or in process of being underway. Now, there are a few other things that we are thinking about as we think about our strategy moving forward. And there are certain things where we're looking at potentially other institutions, thinking about how we would look at growth beyond what I have already articulated. But those are still in very preliminary stages, and there's a thought process going around about what would be the right way to do. I think, though, the most important thing to think about, Josna, is that when we look at our growth, we try to ensure that we maintain the parts that I was talking to you about earlier, which is that we don't want to grow for the sake of growing. We want to grow by making sure that we can maintain that standard and maintain that quality. So if that means X number of hospitals or Y number of patients serviced, that's absolutely fine. We don't have to go and chase more and more and more if that is going to compromise on the quality or going to compromise on the value system. So we are very clear about that whatever we do, it should continue to operate at the highest standard rather than chasing more and more and more and and then diluting that standard.
Something that you said earlier, that you're very focused on the hires or the people that you collaborate with and associate with at the hospital. And I think that's key, because trained nurses and doctors, and somehow in India, the ratio of, say, nurses to patients and doctors to patients is very less. What is your view on this?
So interesting points, and I'll answer that in two aspects, right? So there is a lot of talk in the when you look at things purely from a financial point of view as to what should be the optimum manpower ratios, and whether it's in the healthcare business or in any business, right? Every business looks at this. So in our field, we talk about the nurse to patient ratio, we talk about the doctor to patient ratio, and one could argue that in many cases, Medanta has maybe put more staff to patient ratios than may be considered as the baseline standard in many institutions around the country, or maybe even around the world. And the reason that we have done that is not because it was by default, it was actually done by design. So when you think about the kind of patients that we treat, right, highly complex cases. I mean, in our hospital in Gurgaon and in most of the hospitals, almost 35% of the beds are critical care beds, which is a very high percentage of absolute beds in critical care. We have very high percentage of operating rooms. So you are actually doing very complex work in the buildings that we operate in. And what that could mean is that you may need a little bit more nurses. So you may need a little bit more number of doctors. So while the financial ratios that many people look at in terms of manpower to beds or manpower to patients, they may seem a little bit out of whack in an ecosystem like Medanta. We believe that makes sense because the kind of work which we're doing. Now, are there ways and means that you could optimize that? Potentially, yes. But whenever we look at it, we always look at it from the point of view of saying that, look, what's the right thing to do to ensure that we deliver the right standard of patient care? It may mean actually having more resources deployed in our ecosystem than, let's say, what the peer group may be. But we believe that's the right thing to do. In the long run, that pays off. Right? So we don't want to approach things by saying, let's cut down on manpower, let's cut down on cost. And even when we had situations like with the COVID wave where the work reduced, we didn't make a single attrition during that entire period. So we try to maintain and ensure that we are able to create that entire team concept. Now that is very specific towards Medanta. Let me now take the second part of your question to say that what is happening in the country. We have a huge shortage of doctors and nurses, and we have a huge burden on the entire ecosystem because there are just not enough resources to be able to service all the needs that they are. Obviously, there is a kind of talent shortage, and so therefore many people are competing for that talent. But even otherwise, there's just not enough. So what needs to happen is, number one, of course, we need to get far more aggressive in getting more healthcare talent out there. That means more doctors, more nurses, more paramedical staff. But we have to be cautious. So there are many, many institutions, not only in healthcare, but in every field, and we are producing graduates. But frankly speaking, those graduates are not really competent to do the jobs which they're trained for. So you don't want to be producing MBBS doctors or nursing graduates, and they're actually not qualified to do nursing because they didn't really go to a kind of institution which trained them properly. Because this, unlike many other fields, is really truly a matter of life and death. So these untrained staff, when they come into the ecosystem, if they're not, sufficiently able to do their job, it can be catastrophic. So in Medanta, for example, every single nurse that comes into the system spends somewhere between 30 to 45 days on a orientation before they're even allowed to touch a patient. And these are qualified or even sometimes experienced nurses, because you may not have the same kind of rigor or training that we would expect to put into our ecosystem. So there is definitely a need to have more institutions. There is also a need for other players to supplement this training, whether it is nursing training, whether it is doctor training. And there is a big need for us to do what I call skill shifting. So because of the shortage of nurses, you need to start to think about, well, can we train ward boys to do some of the jobs that a nurse could do? So for example, in healthcare, a nurse is the one who will maybe administer the medicine, but a nurse doesn't need to be the one who is, say, mobilizing the patient, making the patient walk, or performing, say, basic things like oral care or basic hygienes. We can train other staff to do that job. So you free up the nursing bandwidth to do this. Similarly, we do need to make regulatory changes to allow for certain nurses to take on some of the tasks of the doctors. Now, in the US, they have this concept called the physician's assistant. There are certain regulations which are a little bit different there from our country, which allow nurses to take on a higher level role and start supporting doctors in a better way, because we also have a shortage of doctors. So what you do by doing this skill shifting is you allow everybody to practice their art or their craft at the highest end of their training, rather than doing jobs which they have to do at the lower end of their training because there's nobody else to fill that vacuum. And that will provide employment for the people who are otherwise not necessarily qualified in the true sense in terms of degrees. And it will free up the burden of those people who are bearing the brunt of being overworked. So this is kind of how we need to do this. But, the scale of the challenge in India is, of course, huge. Yeah. And, it's also different in different geographies, right? So there may be certain states or certain cities where we actually have a pretty decent manpower or healthcare staff to patient ratio or to population ratio. Whereas in other parts, it's, extremely underserved. In fact, there are parts of, the poorest parts of the world perform better than us on many of these ratios. So the challenge is quite big. But we need to tackle it by doing these multiple levers, putting more capacity in for graduating students, doing more training to supplement the capacity that's missing, doing skill shifting, and then also thinking about how we can change regulations to allow for that job to happen across the ecosystem in a better way.
Right. You're absolutely right. And I think some amount of focus should go on to training and education for doctors and nurses. I wanted to get your view on the National Digital Health Mission, and especially, I wanted to sort of understand what could be the challenges to its success. And then, of course, I'll ask you something else that I really sort of want to talk about.
Sure. So I think, first of all, let's try to understand what the National Digital Health Mission is trying to do. See, and I think it's a brilliant initiative by the government and all the parties that are involved in participating in this, and it's very much required in Indian healthcare. In fact, it is possibly the only way that we can, as a country, aspire to be able to deliver healthcare to the population of our size in a country of our size and complexity. So what National Digital Health Mission is trying to do is trying to say that there are 3 or 4 levers that we want to put in place as a country to be able to provide this healthcare in a better way. One of those levers is to actually say that every patient, every doctor, every institution needs to kind of get tagged into what they're trying to do is these registries. And that really is just creating the foundation for saying that there is an identifier for every individual or every institution in the digital ecosystem. And so those registries are getting created. And that's really just the baseline. You can't start work if we don't do that. The second thing that they're trying to say is that we need to ensure that all of these ecosystems can talk to each other. So the government doesn't want to have the data of me as a patient. Neither do they say that, my data has to be always only available with one particular institution. What they're saying is, if I go to Medanta and I get treated at Medanta, then my data record of my treatment in Medanta will be with Medanta. But if I go to another institution or I go to a family clinic and I get treated there, then my data about that clinic will be with that clinic. And I, as a patient, have the right to authorize these 2 institutions to talk to each other and access my medical records so that I can get better care over my entire lifetime or over my disease spectrum and across the various healthcare providers that I visit. But I will authorize that person. So we create this concept of interoperability where all the data can be flowed seamlessly, and a system of consent where I allow certain people to access my data or not access my data at my choice. And that is kind of what they're trying to stitch together. And what this will do is, by allowing greater sense of ability to share the information, it will reduce the transaction cost of many things in the ecosystem. So let me give you a very simple example. Today, for an insurance company to process a claim, let's say a patient goes to see a doctor and charges, say, 500 rupees for a consultation. To process that claim, the insurance company is sometimes incurring more than 500 rupees worth of cost. Now, it is impossible, therefore, for insurance companies to, on a mass scale, do outpatient insurance coverage because the cost of claims processing with all the paperwork and everything is so high. If we move this into a digital ecosystem and the data flows seamlessly, probably that cost can be reduced to almost negligible amounts. Now, outpatient insurance becomes a reality. It can scale in a much bigger way, and you will have more people covered in insurance, which is better for the population, better for everybody all around. So this is kind of what they're trying to do is put this architecture up. And if you equate this with, say, the digital payments ecosystem, I mean, there was a time when, you could only do cash. Then after cash, they came credit cards. I mean, today, everybody is making payments on their smartphone. In fact, I think the UPI system processes more transactions today than American Express processes across the world, right? And soon we may even beat Master and Visa card in terms of the number of transactions that are processed. So the ability of bringing digital interplay for this transaction between the various stakeholders in the health ecosystem, I think is fantastic. Now, what is the biggest challenge that I see beyond, of course, the operational challenges, which I'll get into, is that we must understand fundamentally healthcare is a human business, right? So you have a situation where you're talking about a patient who is under duress and a care provider, which is almost always a doctor, but could be a nurse, could be a physiotherapist. This relationship is a human relationship of trust. Yeah. We cannot expect that smartphones and National Digital Health Mission or all of these things will bypass and break this. And that is the biggest fear I have, that when we start to get into all these things around technology and people talk about super apps and digital and mobile, we must understand we are dealing with human lives. We are dealing with healthcare, which is a trust-based relationship between a doctor and a patient. And all these things that we put into play must further strengthen that bond of trust rather than try to break that bond of trust or bypass that bond of trust. So that at a philosophical level, I think is the most important thing, and something that worries me the most, that if we go down the path of trying to bypass or break this relationship, it will be the worst thing that we can do for healthcare. But if we strengthen this relationship by adding on to it, it is actually what is needed in the country. Now, that is at the higher level, at the philosophical level. There are, of course, challenges in terms of what are the actual operational difficulties. So one of the difficulties, for example, is that bigger systems like Medanta, we have electronic health records. We do actually capture data. We do actually give patient registration IDs. But, we are still the minority in terms of the healthcare providers of the country. Maximum healthcare is still provided, even in the private ecosystem, by smaller clinics, smaller nursing homes. Can these nursing homes, clinics, can they afford to get access to health information systems? How expensive will it be for them to start to digitize their records? A lot of information is still in paper form. Yeah. Even the systems which have it in digital form, it may not be so easy to transfer that data, because while you write out something in digital, it's actually just one big text file, as opposed to relevant pieces of data that need to flow from one part to the other. So the task is huge. I don't think that it is a trivial task by any stretch. And there are lots of things that have to come into play, including various players in the ecosystem have to start to trust each other. Always either sometimes the government is not trusting the private, or the insurance company is not trusting the hospital. So we have to break down those barriers and be able to create that seamless ecosystem. So today, if you are a shopkeeper and you get payment from a mobile payment system or a credit card, or you're getting a wire transfer in your bank, you're not actually questioning whether that money will really come into me and whether that system will work, because the payment system has been able to kind of go past that trust deficit and actually say that, look, it works seamlessly, it works instantly. You are actually able to get your money, on a real-time basis, and you can get confirmation of it instantly. So all of that kind of works in the financial space, and we will have to do that journey in the healthcare space as well. So it will be a humongous task. I don't think it's an easy job, but starting on this journey is right, and making this approach, at least in the Indian context, is, I think, really the only way for us to move forward.
You're right, but tell me, would data privacy be an issue? I think it could be a major issue, and that's something that, I don't know. What are your views on this?
Okay, so absolutely data privacy is an issue. And I think that we need to understand that the fundamental basis around how we think about this data is being conceptualized in the papers which you see coming out on the National Digital Health Mission in the correct way. And the fundamental concept is that I, as a patient, control my own data. My hospital doesn't control it, my doctor doesn't control it, my clinic doesn't control it, I control it. And as long as we can create the rules and the system checks, IT checks, etc., to be able to say that I am the only one who's authorized to allow somebody else to view my data. And if I choose to withdraw that authorization, then that data gets deleted from the system. Then I think we are moving in the right logical approach. Now, of course, things can happen, like systems can get hacked, and you can have all those kind of issues which exist in every sphere. But I think also we should a little bit understand that this is something that we need to put as a system check into place, rather than say that because of this I can't do it, right? And one could argue that if you actually walk down the street, or if you actually look at how things move in India in the offline world, I mean, there's hardly any privacy for anything in many cases anyway. Not that there shouldn't be, but I think it's very important for us to understand that it's right for us to raise the alarm bells on data privacy.
Yeah.
But we should raise those alarm bells with a point of view of saying, how do we put in checks? How do we overcome these concerns? Rather than say, that's not the reason to do this because I'm very worried about privacy and I don't trust we can solve that problem, so let's not do this. I think that would be the wrong approach. We need to put in the checks and balances, and we need to make sure that they work. And we need to be able to talk about them in a transparent manner, because I think a lot of this is also misinformation and miscommunication. And every stakeholder in the ecosystem needs to do a better job of communicating to other stakeholders to say, look, this is what we are doing. So whether you talk about even with Aadhaar, even with the payment system in the banks, even with all the COVID, the vaccination, there were concerns around privacy. Will my data be misused, etc.? Will it be sold to companies? Will the government use it against me? All these concerns remain in every time you actually are putting this together. But look at the change that it's been able to generate. As long as we put the system checks in place, I think it's the right thing to move forward.
Right. Thank you so much. This was wonderful. And I wish you all the best with everything that you're doing at Medanta. But here's the thing. Before I let you go, one very quick question. What is it that you like to do outside of work?
So I have small kids. So what I love to do most, of course, is spend time with them. I don't spend enough time with them. But the other thing that I picked up actually over the last couple of years is that I've gotten a lot more into reading than I ever was. Mm-hmm. And I feel that just given the lifestyle constraints that I have, it's a great way to get exposure to other thought processes, whether it is fiction, whether it is non-fiction. Yeah. So I've actually got quite into reading in the last couple of years. So I think that's what keeps me going as well.
That's wonderful. For our viewers, could you tell us which is your favorite book? Or what is it that you're reading right now?
So I'm reading actually a couple of books right now. In fact, 3 simultaneously. I'm reading A Gentleman in Moscow, which is a great book, quite entertaining. I'm reading Where the Crawdads Sing, which is also a new book. And I'm reading a book called Net Positive, which is how businesses can strive to do more than just be businesses and actually think about what's the value that they contribute to society and the world. So those are the 3 books that I'm currently reading. Last year, I spent a lot of time reading. I read over about 25 books. And one of the books which I thought was very interesting and very different was a book called Overstory, which is basically a story about, I think it was about 8 or 9 individuals told, but it's told through the story of the trees and the life that they all lead, which is anchored in trees and in nature. So I thought it was a very interesting and very new kind of book.
Sounds very good. Thank you. Thank you for speaking to us.
Thank you so much.